Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with a weekly podcast of what I call the Common Sense MD. Today I'm going to talk about ivermectin. It's really a three-part series. Last 2 weeks, if you've been watching this, the first week I talked about COVID-19, what really went on. Second week I talked about the vaccine for COVID. And I'm going to talk about ivermectin. Can you believe I'm even saying these words after 4 years of being censored? Now, believe it or not, we live in a free society, so we can say what we want, hopefully forever. So I'm going to talk about ivermectin because it really completes a lot of the things that we've talked about, because it was the ultimate treatment for COVID-19 at the time. Certainly when COVID-19 happened, nobody really knew what to do except a few common sense people that used some repurposed drugs that worked. They didn't have time to do the double-blind studies, placebo-controlled. They just needed something to work, and certainly ivermectin was one that really worked in most all the cases that I treated. And I treated thousands with this. Of course, the first drug that we used was hydroxychloroquine. It's interesting because hydroxychloroquine was also very useful. Turns out ivermectin probably worked better, but hydroxychloroquine is what we call a repurposed drug, kind of like ivermectin is. Remember, hydroxychloroquine was used to treat malaria very effectively, but they also found it worked for lupus and rheumatoid arthritis, as well as many other things. So it became approved for those uses as well. And I think the same thing is going to happen for ivermectin, which is also approved by the FDA for certain uses. Not at this point for COVID, but it's just interesting that we can even talk about this without being threatened. You know, there's very few drugs that I would call wonder drugs. I would call penicillin a wonder drug. I would call aspirin a wonder drug. And I certainly would call ivermectin a wonder drug. This drug, originating from a single microorganism found in Japan, the soil of Japan, has improved the lives of billions of people worldwide. It was originally introduced as a veterinarian drug, and it was quickly discovered that it also combated two of the world's most devastating diseases, mostly in Africa. Onchocerciasis, which is a parasite that caused something called river blindness, and strongyloidiasis. Also, it was found to be very effective against the worms that caused elephantitis. So it was found to have, these anti-parasitic uses. It actually won the Nobel Prize for these. Since then, it's been FDA approved for other things like lice and rosacea. Very safe. It's been being studied now for many other things. So it turns out it's a multifaceted drug with great potential, even though it's been so downplayed and made fun of by the FDA. It was really sad that they did that. It was really pitiful, in my opinion. Why they did that, who knows? It's a very safe drug, very safe like hydroxychloroquine's very safe. They tried to scare you off using that one too. But anyway, it's very, very safe, used billions of times. And, of course, we're going to talk about COVID-19, the effectiveness with COVID-19. They had both in vitro and in vivo studies that show it worked. Not every study showed it worked, but many studies showed it worked. And I know it worked because I used it thousands of times. I took it. I take it still when I need it. But it's highly effective, would turn it around very quickly. Not 100% of the time, but most of the time it really worked, especially if you used it early on and use it in combination with the other things like high-dose vitamin D is one of them, and many others that we had a protocol for put out by the frontline doctors. It was very, very effective. And one thing I want to shout out is our state, Tennessee. People think we're a backwoods state, unlike California or New York. New York, thank God we don't live there. But Tennessee is really the only state where you can get ivermectin over the counter at certain pharmacies, backed up by physicians. And certainly that's an amazing statement for our state. And it's great. We also didn't have the stringent lockdowns and mask requirements that both New York and California had, many other states, thank goodness. They were still overly reactive to it, but hindsight's always 20/20. But that we were very progressive when it came to treating COVID, in my opinion. I probably would have lost my medical license if I'd been working in some other states. So I'm thankful that I live in Tennessee. So it worked very quickly. It's a very safe drug. Amazing! It's an amazing thing that you just, in over 30 years of use, you just don't see drug resistance with this drug like you do so many other ones. The side effects are extremely rare. I saw a few cases of a little loose stools or upset stomach with it, but very rarely saw anything with it. So very, very safe. But I found it to be helpful for many types of infections, not only parasitic, but also viral and fungal as well. It also works for bed bugs, some tick infections, asthma, some neurological disorders, and perhaps the most exciting to me is a continuously accumulating body of evidence that ivermectin may have substantial value in the treatment of a variety of cancers. And that's what really excites me. I'm already using it in some cases for this as an adjunctive treatment. The mechanism by which it seems to work is complex, certainly too complex for this podcast, but you ought to do your research on it. It inactivates something called protein kinase, PAK1, which is essential for the growth of more than 70% of all human cancers, including breast, prostate, pancreatic, colon, gastric, lung, cervical, thyroid, liver, gliomas, melanomas, multiple myeloma. And certainly I'm not saying that this is going to cure every one of those, but it's been this PAK1 is involved in all those cancers, and this is what it acts on. It's also been found to be very synergistic with certain chemotherapies to induce cell deaths of leukemic cells. Ivermectin has been found to inhibit proliferation of cancer cells, and it increases apoptosis, which is programmed cell death that needs to occur of various human cancers. It also inhibits microtubules. If you remember, that's the way that it worked for COVID. Microtubules are networks that cancer cells and the COVID cells, by the way, got into other cells to travel and metastasize. They work really kind of like chemo. Chemo works on certain chemotherapeutic drugs work on these microtubules. It's just you can use it without the side effects. So ivermectin, to me, does qualify as a wonder drug and has multiple uses. I've recommended it to thousands of people. I also use it as kind of a preventative thing. When I'm traveling, I recommend it to people when they're traveling to take some ivermectin with them. Started the first sign of getting sick. If you start to come down with a cold or sore throat, I always start popping it immediately. And when a cancer patient comes to me for adjunctive treatment, and again, I always tell them, make sure you see your oncologist, your surgeon, whoever. But if they come to me and they have an open mind and they've done their research, which most of them have, that come to me for these add-on therapies for cancers, very safe. I use a lot of fenbendazole, which we've talked about, and I use ivermectin. I use both of them together. If they so choose. Remember, when you're a cancer patient, you need to do everything you can do, and it's your choice. But I certainly recommend you. We've made a lot of strides with cancer, in some cancers, other cancers, not as much. But I'm hopeful, and pretty soon we'll try to do a podcast with an oncologist that has an open mind. I also use several other adjunctive strategies for cancer patients because you really have to do everything possible. And there's a lot of things that really, I think, do help. So you really have to kind of do the research and figure it out a little bit for yourself, along with your oncologist and maybe a practitioner that is willing to add some herbal medications and supplements that will help you. So in summary, I found ivermectin to be a wonder drug. I really love ivermectin. I keep it around. I take it when I need it. And so I encourage you to do your own research, and I hope you stay healthy and safe. I'll see you next week. Thank you.